So we've gotten some questions about the crow's feet and what people can do to treat that area.
Super common area that we treat, and we treat it with Botox. So there's 3 FDA approved indications for Botox on the face. There's many therapeutic places for Botox we don't have to get into today, but would be a good topic at a future discussion. So the 3 muscles that are FDA approved, number 1 was the glabella. So or corrugator, the vertical lines between the eyebrows, like these guys. And then came the crow's feet. And then third came the frontalis, the horizontal lines on the forehead. And so Botox is a drug that partially paralyzes muscles, prevents that neurotransmitter from leaving the nerve and telling the muscle to contract. And so we use this property and we deliver the Botox locally in certain muscles to decrease the muscles that cause certain wrinkles. And so in this case, the crow's feet are caused by a muscle called the orbicularis oculi. So when I smile, I've got a little Botox, probably could use a little more, but you can see I get these little lines that radiate or come out of what we call the lateral canthus or the outside of the eye. And so we can target that area with Botox and partially paralyze that muscle. The goals are a little different in different areas. So the goal here, when the corrugator, I don't know if you can see that, like this guy, when people have that vertical line or even the procerus, that horizontal line on the bridge of the nose there, the goal there is to 100% freeze that muscle. No one ever misses that face. In the history of Botox, no one's ever complained about being too frozen here. But it's the opposite on the crow's feet and then the frontalis of the forehead. So you still want to be able to raise your eyebrows. When you smile, you want some animation. And so we partially paralyze that muscle. So when you smile, everything out the mouth, lower face is the same, but there's a little decreased motion in this area. That's the number 1 indication, or number 1 reason people do Botox in that area is to decrease the wrinkles. But as a side benefit, and many women love, is that when you paralyze the upper outer portion of that muscle right here underneath the tail of the eyebrow, you're paralyzing the muscle that pulls down the tail of the eyebrow. So you're paralyzing the depressor. And so that the elevator is left unopposed. And so if you paralyze the depressor and not the elevator, the net effect is you're going to raise the tail of the eyebrow. It gives you more of an arch. It also makes your eye appear more open, bigger, especially when you smile. See how my eyes narrow when I smile? That response is blunted when you put Botox in that area. So it's an awesome area for Botox. It can be overdone, so I err on the side of lighter. I'd rather a patient come back and want more than overtreat, and then they're too paralyzed. That doesn't look terrible, but sometimes when a new provider or someone that doesn't know what they're doing, they put too much Botox in this muscle, it's completely paralyzed, and you need that muscular function to help drain the lymphatic system. And so you could get a buildup of lymph underneath the eye and get a bag even. So really there's an art to that area. I would say the number 1 complication in that area is that the skin is thin and it's a very vascular area. So there's a higher likelihood of bruising in that area. Again, go to someone that has a lot of experience. The likelihood is going to be decreased. Very superficial injection, minimal number of injection sites, able to identify, a vessel. Obviously that's not that difficult, but some are small and some you don't see. So bruising can occur. A lot of people ask about putting filler in that area. That's super rare. It's possible, but you really have to have deep lines. And the difference is those are static lines. So lines when you're not making the face as opposed to dynamic lines. When I smile, I get the lines. When I'm not, they're barely there. So that's a dynamic line. Static, when I'm not smiling, I still have deep lines. Certain older patients that have really, just powerful orbicularis, ignored it until their 50s, 60s, whatever, we may address that area with filler, but it's pretty rare. So Botox for crow's feet. Love it.